Before you open a new browser tab and type your back pain symptoms into a search engine, I want to suggest a better first step, one that gives you significantly more useful, actionable information than any general symptom search can. Searching back pain symptoms online is a uniquely unreliable experience because the same symptom points toward a dozen completely different causes, ranging from a tight muscle to something requiring urgent medical attention, and a general search presents all of those possibilities simultaneously with no way to weigh them against your specific situation. A structured self-assessment does something a search cannot. It asks you the exact questions a physiotherapist would ask in a first clinical consultation and uses your specific answers to build a meaningful picture of what your pain most likely involves. Let me walk you through what a proper back pain self-assessment covers and why each section matters. The first dimension is location and radiation pattern. Is the pain in the lower back, mid-back, or neck region? And does it travel anywhere? Into the buttock, down the back of the thigh, into the calf, or all the way to the foot? Pain that radiates below the knee is strongly associated with nerve root involvement, either a disc pressing on a specific nerve root or piriformis syndrome compressing the sciatic nerve. And those two causes require completely different treatment approaches. That single dimension already narrows the diagnostic picture substantially. The second dimension is temporal pattern, how the pain behaves across time and across a typical day. Is it worse first thing in the morning and eases as you move through the day, which is characteristic of inflammatory and disc-related conditions? Or is it fine when you wake up and progressively worsens through the afternoon and evening, which is typical of postural loading and muscular fatigue? Does it ease with movement or worsen with it? Is it constant or does it come and go? These behavioral patterns carry significant diagnostic weight, and physiotherapists use them to narrow down the cause of pain substantially before the physical examination even begins. The third dimension is aggravating factors. What specifically makes it worse? Does sitting provoke it most, which strongly implicates this pathology because intradiscal pressure peaks in a seated position? Does standing or walking aggravate it, pointing more toward facet joint irritation or spinal stenosis? Is walking relieved when you lean forward over a shopping trolley or a fence? Because that specific pattern of flexion-relief during walking is the clinical hallmark of lumbar spinal stenosis specifically. Does coughing or sneezing sharply increase the pain, which is associated with this pathology compressing a nerve root? The fourth dimension covers neurological red flags that bypass the self-assessment entirely and require same-day medical attention. Any change in bladder or bowel function alongside back pain is urgent. Numbness in the saddle area between the legs, progressive leg weakness that is measurably worsening day by day, or pain that is completely unrelieved by any position are all serious. If any of those apply right now, stop watching this and contact a healthcare provider today. Not next week, today. Assuming those do not apply, the assessment produces one of three outputs. Your pattern suggests a condition you can begin managing at home with specific exercises and load modifications. Or it identifies features that mean you should see a physiotherapist within 1 to 2 weeks before the problem becomes chronic. Or it flags that your pattern warrants assessment this week because something specific needs to be clinically evaluated. Having that clarity removes the anxiety of not knowing what you are dealing with and replaces it with a specific, proportionate next action. When the result says home management, it also gives you the specific home management steps most appropriate for your symptom pattern. Not generic advice, but steps matched to what your answers reveal. When the result says see a physio within 1 to 2 weeks, it explains which features of your pattern made that the appropriate recommendation, so you understand the clinical reasoning behind it. When it flags see a physio this week, it tells you clearly which symptom is driving that recommendation, so you can communicate it accurately when you book. That level of structured clarity is something a general symptom search cannot provide, and it takes less time than reading the first search result. The self-assessment in the link below takes 2 minutes to complete, costs nothing, and requires no registration. Use it before you worry further about what your symptoms mean.